Defense Production Act. In the Defense Production Act, the President of America can tell any organization or any production house to produce something for national security.
Right.
You know, so they have that
so
sort
we have
of
gotten to that
arrangement.
point, really.
I don't think we've gotten to there, or even if we haven't gotten to there.
What do we need to see to know that we're there?
Well, the community transfers of the infection, you know, because now most of the infections are from those who have come from
That's because
outside.
we're not testing frequently out there.
Well,
so
yes.
we're not too sure if we have vertical infections.
Exactly. And that is why the government and the Ghana Health Service and everybody is talking about social distancing.
Okay.
Because it is important that you maintain social distancing and then have the hand sanitizer and hand washing.
Okay. Let's look at the dynamics of our population. We'll place the Italian example in perspective shortly, but let's look at the dynamics of our population. The last time we checked, per your census that you conducted, you said...
Statistical Service.
Well, they did, but you did some analysis on it, that 27% of us are taking care of 73% of all of us, which means that our population is largely informal, and which means that a lot of people don't have places they can call their home, so they are out there. Can we really do a decent social distancing with such bare facts looking us in the face?
Well, that is what we have, and if we want to flatten the curve, then we have to. That is why it is important
to attend nature's call in public toilets.
Well, that is
people eat from chop bars.
Yes, that is why I think that we should have set. We should set standards for Ghanaians.
Okay.
Every home should have a toilet. We should have a quality of life that no Ghanaian should fall below, or at least majority of Ghanaians should be within.
Okay.
You know that you should have a decent home, toilets, and a water supply. That's human rights. That should be the basic for any Ghanaian. Then the rich people can have the mansions and all that.
But that's a stance we don't have.
You know, but then everybody should have.
Everybody should have. I mean, it's been said over and over again. The district assemblies have their own bylaws that says if you don't have this, we will deal with you. It comes down to strict enforcement. You work in a population environment, and I'm saying that per the bare facts that we have, tomorrow morning somebody will jump onto a trotro. There are 4 people on one lane. That's not social distancing. Well,
that's not social distancing. But then, you see, when I was growing up, the primary school I went to, ANT1 Primary School, we had social distancing there.
How did you do that?
Yes, because you see, the tables were very far apart.
Right.
You just had about 30 people in a room,
right,
in a class. That's what we had.
That's true.
You know, but then somehow we have not maintained that because all those there were reasons why they did that. Why you have optimal number of children in a class.
Okay.
You know, but this COVID, it's not just about social distancing. It's also about the person. Okay. It's also about your immunity. You know, soldiers always train, even when there's no war.
That's right.
Because you always have to train.
Endurance,
yes, and be resilient for when the need arises. And so, even apart from our hand washing and things, we should also have been building our immunity just in case something happens. You know, so.
Let's go back to the dynamics of our population and match that with the Italian example. They hesitated to do a lockdown, and now we're reading their figures are skyrocketing. If you look at our population, and again, this one I'll push you to the wall, the experts who have been calling, you're an expert as well, would you recommend a lockdown?
Well, the issue is that if you look at the Italian situation, and the figures we are getting, they're talking about a lot of them being in the older bracket, and it's all because of the immunity.
We have older people too.
Because if you look at the percentages, because you're looking at about more than 10% of their population old, and we have just about 5% of our population old. The issue is that the population dynamics. You can have young people having the infection and not even knowing that they have the infection. Okay. So the young people can transmit the infection to the old people. So they will not be sick, but then the old people can be sick. Right. You know, because look at lots of the Italians. They were in their homes, and then they got the virus. Then they have people taking care of them. So it's possible that could have been the transmission. It's mainly social distancing, hand washing, keeping hand sanitizers, personal hygiene, and then the other thing we don't talk about is the immunity of the person.
You speak about these things as though they were very easy to achieve. I'm looking at a typical situation at Choco, for example, where somebody wakes up, he doesn't have running water, so he'll have to walk another 100, maybe 150 meters to go and get water. Come back, it's a public bath space, go onto the seaside or maybe a public toilet to ease themselves. In all of these various junctions, maybe to find something to eat afterwards, they are touching surfaces, they are holding people. We live as a communal people.
Yes.
Social distancing is not in our DNA.
Well, you see, we were shaking hands before COVID came.
Right.
We were having funerals before COVID came. Our DNA is to shake hands, is to be in community, but the DNA is what the virus was using to kill us. And so we decided that, okay, then let's social distance.
Okay.
You know, we have to let science guide whatever we do. If the virus is transmitted by touching things and doing these sort of things, then it means that that's what we have to stop if we want to survive.
You're a public health specialist.
Yes.
Sorry about that. Let me, so at what, let's look at the various stages of the infection, which would, if you like, graduate and amount to a lockdown. Stage 1, stage 2, stage 3, if you will.
Well, like we started with the COVID, it was important.
Okay.
And so that one we could isolate, you know. But then when it gets into the community, then you don't know, especially since we don't have all the tests.
Okay.
We don't have the test kits. So it's difficult to really see how fast it's spreading. And the most important in epidemics, that you don't overwhelm your health system.
Okay.
Because with a viral infection, most of the time the body, if it's resilient, will take care of itself.
Do you see an overwhelming situation of our health situation coming up?
Well, already our health sectors are overwhelmed, even without COVID-19. The health system already overwhelmed.
Right.
I mean, you know that. Yes. And so we have to do all it takes. Also looking at the economic aspect, because you cannot keep people isolated for COVID-19 and then they die from hunger or die from other things. And the reason why we also have to overwhelm our health system is because, yes, we have COVID-19 now, but we're still going to have our strokes, we're still going to have our hypertensions, our diabetes, the women are still going to deliver, and it's the same health sector that is going to take care of that. And that is why if you look at other places where they plan for such eventualities, the U.S. Army, for instance, is bringing the ship, the hospital ship, so that those who are not COVID-19 can go on there. And then the British are using their long trains as hospitals. And so you have to
what do we have?
Look at. Well, we have the schools that we have. The children are no more there. We have the churches that are closed now. We have the hotels.
All these places don't have equipment. So it means that if we have to move people there, quarantine them and take care of them, means that we need equipment.
So we'll have to look at the caliber of people we can take there. That is why even before we lock down or whatever, I think we should do all this analysis. We should do all this analysis. The regional coordinating councils or the regional directors of health should link up. They should have a task force, you know, to look at all these, so that just in case where we can take who, because we have to look at the facilities. We need water and toilet facilities, so we can do all those assessments. And then if the need be, we'll see how best to.
So point 2 is that our health system must not be overwhelmed. What's the third point?
Yes. Well, the third point is that the citizens also take responsibility, because we have to understand that I protect myself, you protect yourself. If you have the virus, for instance, within 14 days, 21 days, you can recover, so that you do not transmit to another person. So it is important that you do not act as an agent of transfer, because you can be healthy, and so you can just carry the virus, but then you will be the intermediary and you can transfer to somebody else. So we have to have personal responsibilities, and most importantly, not overwhelm the health system, because the health workers can also fall sick. And if they fall sick, then they're out of.
Bringing back our retired health professionals, is that the best decision we could have taken in these times, talking about not overwhelming our health system? Now we have external help coming in. Experienced hands?
Well, for infection such as COVID-19, it's not so much as the people, but the equipment, the PPEs, you know. So if you bring them in and they don't have anything to don, then it's a challenge, you know. So the PPEs are important. Everything, you see, we have to look at it holistically. We have to look at it holistically.
Are we doing that now?
I'm sure, yes, the Ghana Health Service and the team is looking at that holistically. Okay. Because this is not the first time that we're dealing with COVID. But how much time
do we have? I mean, the virus determines the timelines. We don't. Yeah. So the virus is dictating to the world what it must do.
Yes, and that is why the world is also behaving how it's behaving. The Ghana Health Service and the team that has been set up by the government is looking at all these. You know, it's looking at all these, and that's why they took the decision to close the boundaries when they needed to take that decision.
Okay. So. This is Hot Issues. Return with some more conversation. My guest is Dr. Letitia Adelaide-Appiah. She's the boss at the National Population Council. She's a senior public health specialist. It's Hot Issues. See you after the break.
Alomo bitters. If you do me no chini, that's so authentic.
Anio, any entry.
Alomo ya, Brahma Yanchi and here. Maybe I can pack with Sham Alomo ya, Shami Alomo now says Angla. Ya couldn't say ya, ya don't say ya, ya couldn't say ya, ya couldn't say ya, ya couldn't say ya. Alomo ya, Brahma Yanchi and here.
Alomo Bitters, 20 years, the Camry Pakroji. Num Yansem, one Tomanipa winning Fiedu Watch, and Sessa Pimfonum. FDR, you say Jadian Craft to Imagiatum say, yeah.
Alomo, authentically African. There's this guy who have 3 things in his life: huge winnings, fast pay, and high odds. And one day, he placed a bet. And he made lots of money.
But where?
At 1xBet.
And who's that guy? Is it you?
No, it's you.
Welcome back to Hot Issues, and if you just joined us, you have met quite a lot, but there's a lot more coming your way. My guest is Dr. Letitia Adelaide-Appiah. She is a physician. She's also a senior public health specialist and the boss at the National Population Council. And we're discussing what the nitty-gritties, I beg your pardon, are if we decide to have a lockdown. Doc, welcome back from the break. Let's look at who will be hardest hit in this. The pure water sellers will not be there. The driver's mates will not be there. Yeah. The carpenters, the masons, the steel benders, the coffee brookman seller will not be there. The watches seller. Yeah. These are all people who earn what we call by day. Yes. So they buy, they sell, they get their profits, they spend, they come back. Yeah. Literally no savings. Exactly. They will be hardest hit. Yes. What help is there for them?
So that is why we really need to start looking at it now. And we need to, for me, decentralize it at the regional levels, because I don't think that everybody wants to live, you know. So we need to have that discussion and need to have that in mind, that there are people who earn 10 cedis and that's what they spend. Okay. You know, but for me, when all this is done, then we have to decide as a country. Do we want people to earn 10 cedis a day? Okay.
Minimum wages used.
Exactly. Okay. You know, so that what do we do to bring ourselves up a bit? Because you see, in emergencies, the quality of life goes down. Okay. It doesn't matter whichever level you are, it will go down. And so if your quality of life in calmness is down, then you are in trouble. That is why it is important that at least you bring your quality of life to a certain level, so that when it goes down. I was watching CNN today, and they are talking about their problem is that the women are going to deliver and their spouses are not there. That's
luxury here.
Well, that is luxury here, but that is how far they took their quality of life, and so they have come down. Okay, you know. So the 10 Ghana cedis you said, the pure water sellers, drivers mates, and all of them need to understand and appreciate what we are doing, and then all of them need to also to be sustained somehow. Okay. So how do we do that? Should be the discussion.
Let's look at the alternatives. So can we choose one day in a week, maybe 2 days in a week, to say, yes, Ashaman, you are locked down, but on this day you can come out, or maybe can government get the goods and go to a central point where they can come up if we want to decentralize? Can we do that?
You see, if you want to lock down and leave essential services, then it's good you do it uniformly.
Okay.
Just like when Ghana Health Service is doing their immunization service, they take a day and immunize the children.
Right.
So that it's good to do that in infection prevention, so that you've immunized these people. We don't have a police state to say that Ashaman cannot go to Accra, Newtown, and those type of things. So you can still be locking down whichever you want, and then you can still
But you don't have correct street naming systems. You don't have a proper working GPS.
Yes.
So how do you even do deliveries, for example, if you're deciding to use courier services?
Well, yes, courier services. How do you do deliveries? But those of you in nice houses can do courier services.
Well, but I'm not talking about me. I'm talking about...
Yeah, so I'm talking about the majority who 10 cities, which even courier services can they do.
Okay.
So we have to look at that very well before we take the decision. Because like I'm saying, we don't have to take one decision and create another.
Okay.
We don't have to try solving one and then in the process create another. So we have to soberly all look at it.
While we wait, what dangers are we faced with?
Well, the social distancing, the hand washing. Then what we can do now is also to make sure that as part of our corporate social responsibility, can we distribute free hand sanitizers to the people to start with?
Are you talking to the churches?
Well, everybody. Because you see, we are all in it together. It is not you and anybody. It's all holistic. And for me, this COVID-19 is really testing our sustainable development.
Right.
Because now countries are isolated. Every country is within. So how sustainable are you? How sustainable can you be 3-4 days even without external support? So we are all in it together, and we can have industries providing water, even if it's tanker services, if it's hand sanitizers, because if the infection comes up somewhere, it started in Wuhan, China, and it's everywhere in the world.
Right.
And so if it is in Ghana, then just location from East Legon to Agbebloshi, where we all go to shop, it's not.
Churches have been closed, mosques as well. No funerals, no parties. But the beer bars are open. Should they be shut?
The beer bars are closed, I think, or they're open.
They're open. A few of them are open. People are sitting, and people are at the beaches until last Tuesday when it was shut. But
so it is shut.
People are out there. Yeah, the people are chilling.
I think that the education should go, and I think that we should use our priests, our imams, our traditional rulers for the education, for the hand washing, sanitizer. I think we should use them as part of our communication strategy, so that I see my chief, talking about hand washing, and then the people would, the chief imam talking about it, so that, because we should. I think now the issue is that they think it's a rich man's...
exactly, a rich man's disease.
Rich man's disease.
And the black man cannot get it.
And the black man cannot
Dr.
get it.
Dr. Sari of Kolebu said the sun would be too hot for the virus to survive in it. He told us that in our face.
Well, you see, the body has a constant temperature.
Okay.
The body's temperature is the same, whether the sun is hot or not, And so if the virus is on the hand, the virus is in the mucus.
So that cannot be true.
Well, maybe under some high temperatures, because it's a protein. So under high temperatures it can degenerate. But then I don't think that should be, because already here we have other viruses here anyway.
People are panic buying at this point. For you as a population person, that's not too good, is it?
No, it's not good that we panic buy, because when we panic buy, unfortunately, we'll have people also increasing the prices of goods. And that creates more inequality. Because these people earn 10 Ghana cedis, and they were buying the hand sanitizer for maybe 1 cedi, even if they could afford 2 cedis, if they could afford. And now it's 10 Ghana cedis. Right. I think we just have to know that we have to appreciate the oneness of Ghana, and know that I'm hoarding, somebody is not hoarding, and somebody is not having access to it.
Should the government step in and standardize the prices and say, don't sell this beyond this price? Well, because in the end, we want every member of the population to benefit.
That is true. I think so. These are not normal times. These are like war times. And in war times, the leadership should step in for the good of all.
Okay.
So yes, the government can step in and say, this industry, produce this for that. As even part of your social corporate responsibility. Produce this for this, at this time, for this period.
Okay.
That, I mean, we are in this, you know, the water tankers. Supply water to Agbogboshi, or if we decide to put them in zones. Okay. Supply water to this place for this time, for that. Papa, supply food for these people for this time, to that. I think we can do that as part of
the president should be making that call at this point.
Well, I'm sure that they're thinking about that, because if you want to flatten the epidemic and you want to keep people stable where they are, then you should be thinking about how to sustain them too. Okay. And all these are part of it. We do Miss Ghana for corporate social responsibility. We can't do that now. So how can we channel the money? School feeding, for instance. The children were supposed to be in school and be fed. Okay. They are home. So the school feeding, if we decide to zone, it means we can have some feeding for a couple of days for the people who will be there. You know, so we really have to look at it, and for me, have a two-pronged approach. As we're looking at the health sector with the PPEs and the medical staff, we're looking at the other part of it, where we're looking at the community as a whole, how to keep us safe so that the infection does not spread to overwhelm the health sector. Because we still have to get malaria and other things.
The bigger conversation there will be the larger impact on our country when all this is said and done. Some think tank says that we need 15 billion Ghana cedis if we want to do the shutdown, at least for 2 weeks or so. This will take a toll on us, especially for those who are earning 10 Ghana cedis. He that is down needs fear no fall. But I'm sure after that COVID-19, they may not be here to fear the fall at all. What hope is there for them?
Well, but the issue is that, you see, I think that, I don't know, I may be wrong, but I think that the economy is the symptoms of the health of the people. Because it is only healthy people who build economy. Right. And so if the health of the people is compromised, then the economy will also suffer. You know, I don't think that we should look at everything in terms of the money, especially in these times. Keep people healthy. When they are healthy, they would make money. It's only healthy people who make money. Sick people don't make money. But
in a peculiar situation where the informal sector largely is not captured by the tax net, this assertion begs for some explanation, don't you think?
Well, that is true. That is true. I mean, we have a peculiar situation. And for me, I think that the situation in which we are after COVID-19, we should really look at it critically and see if that is where we want to be. Because you listen to news from outside, and they're talking about packages for citizens. Stimulus packages for citizens. You know, which means that they saved.
But how do you even identify the people to give?
Well, so that is why we have to look at our identification system. Okay. That is why, for me, if you ask me, then we have to go to the birth and death certificate, because the birth and death is the beginning.
Could that explain why the NIA is still out there trying to register people? And obviously, you don't know about that. Okay. Doc, I thank you very much for your time this evening. Most grateful. And I've been speaking with Dr. Adelaide Letitia Appiah. She's the boss and the director of the National Population Council, also a physician and senior public health specialist. We'll be looking at the nuances of a possible lockdown if it does happen. The calls have been made. The president's decision to take. Whether he takes the decision or not, there will be consequences. If he locks down today, we will have consequences. If he doesn't lock down today, there will be consequences. And while we wait, there will be consequences. I can only tell you to be safe out there. Stay at home if you don't have to go out. Wash your hands with soap and under running water. Eat healthy, exercise, eat your fruits and veggies, vitamin C, mango, oranges, pineapples, your lemon and your lime, and stay safe. Cough into a tissue and dispose it immediately, and wash your hands. Use your hand sanitizer. I'll see you next Tuesday. Good night.